the CCG, because I'm not too sure how firmed up their plans are in terms of pieces of work to improve services. I mean, it's set as a priority for the financial year 2014 to 15, but timescales within that I'm not too sure of. I mean, what I'll do is I'll find out for them and try and circulate with the minutes this meeting. I mean, in terms of housing.
Well, that comes into mental health and
yeah. Yeah, I mean, at the last mental health group, we had someone come from Broadway who works particularly with homeless people around mental health.
I think that's my manager from my centre.
Adam.
Oh, Adam from the day centre, yeah.
Yeah.
Because we're working in Charing Cross Hospital at the moment, but we're also working with the mental health unit, and we're getting referrals from people who've got homeless patients. Yeah. And then we're advocating for them and supporting them to try and get them housing on their discharge. So yeah, that's a bit different to Adam's role, but yeah.
I mean, one of the things we talked about is that there's some significant. Well, we talked a little bit, I guess, about the impact of poor quality housing and insecure housing on people's mental health, but we also talked quite a lot about how being homeless reduces your access to services. Becomes a lot more difficult to access those. I mean, we were talking particularly about mental health, but I think it's quite true for, a range of services. Yeah, and I think that's something we're quite clear to feed into the Health and Wellbeing Board locally. I'm not sure, does everyone know what the Health and Wellbeing Board is and what it does? Okay, so Health and Wellbeing Boards are also quite new. They kind of started up around the same time as clinical commissioning groups and Healthwatch, so they're kind of brought in as part of the whole range of reorganisation around health and social care. They are responsible for compiling local health and wellbeing plans and strategies for each local borough. They're made up of local authority representation, so they have the cabinet member for health and social care, which in Hamilton Fulham is Marcus Ginn. Cabinet member for children, and I think it's children and families, or it might just be children's services, sits on there as well. Tim Spicer, the head of Hamilton Fulham Clinical Commissioning Group, sits on there. A representative of NHS England sits on there. The representative of the public health team in the tri-borough sits there. So that's normally one of the three directors of public health sits on that group, and then also a representative of Healthwatch sits on that group. So our role is really to kind of feed in information gathered at meetings like this and various other kinds of outreach and other meetings we go to build up a kind of idea of what local people are saying, to then feed into the Health and Wellbeing Board. One of the key things at the Health and Wellbeing Board, one of their key priorities as part of their strategy is improving mental health. And so some of the issues around housing, we would like to feed into that as well. It's not always the easiest forum to feed into, if I'm being completely honest.
I think housing is the worst. I know a lot of people in other boroughs, and none of them like this borough is a hell.
I know there's a lot of issues with housing in this borough. I mean, the availability of affordable housing, social housing, accessible housing, say for people with disabilities, etc. And also a lot of question marks around the big housing schemes.
Well, they removed everybody with LD off the housing register.
Yeah, because I think they changed the criteria recently and they did review.
2 years ago.
No.
Just this year, I think.
2013, April last year.
They removed everyone?
Yes.
Removed everyone off the housing register. My son was on it for quite a considerable time and they removed him off. And they say that he doesn't need enough care to be able to get placed. But now, I mean, not talking about one individual, it's about everybody that's been knocked off. But their care is going to be, there's going to be more care required for them because they've been knocked off the housing register.
Where are they supposed to live?
Well, they're supposed to live with their parents, but if we...
Preferably out of the borough, I think.
Yes. But if anything happened to us, that's what would happen. They would be out of borough.
Yes. Yes.
And think of how much it would cost them. Think of the bereavement to that person. It's massive cost all round.
No,
So-
I mean, yeah, no, Margaret's absolutely right. I mean, there are a lot of issues with housing locally. I think the difficulty for Healthwatch has been about how to address the issue from a purely health perspective, because obviously housing is one of those, it has some health elements, but it has a lot of other elements as well. And I think we probably need to think a bit more about how we kind of can gather evidence about how the housing situation affects people's health, rather than how it affects their life quite broadly.